Some kids avoid writing, but it's not because they're lazy, but that the motor skills required for writing are hard. Let's talk about motor dysgraphia, what it is, what it isn't, and how we can help. Motor dysgraphia is a specific learning disability in written expression, characterized primarily by difficulties with the motor skills needed to produce legible handwriting. You might notice slow writing, inconsistent letter sizing, mixing lowercase and uppercase letters, or a helper hand that doesn't stabilize the paper. You also might notice too little or too much pencil pressure or formation that's always changing. Since fine motor skills can affect other daily tasks, you also might see difficulty with shoe tying or even using utensils. This is not about effort or intelligence. These students might have really strong listening and speaking skills, and spelling might not be affected. When writing feels physically hard, students can feel frustrated or self-conscious, which can reduce their confidence and their participation. So addressing the motor foundation supports not just handwriting, but their self-esteem and access to learning. Occupational therapists can assess for tools that promote a more functional writing position, such as different pencil grips or a slant board for the wrist. OTs can build hand strength with therapy, tweezer, or clothespin activities. We can incorporate in-hand manipulation, such as flipping small objects in the hand. We can also add core strengthening exercises because stability at the trunk supports mobility at the hand. We can practice bilateral coordination through cross-body movements in tasks that use both hands together. Mechanical pencils give feedback for pressure. Explore different adapted paper. Teach use of a spacer tool. And always use a multi-sensory approach for teaching letter formation. Make sure you collaborate with the whole team to find accommodations that will help the students' participation and access. Consider reduced workload, extended time, and allowing for oral responses for some assignments. These supports help the student demonstrate their knowledge without being limited by fatigue. Students with motor dysgraphia may find keyboarding challenging at first because it does rely on that fine motor coordination. But with structured instruction or dictation tools, technology can help reduce fatigue and help students express their ideas effectively. Supporting motor dysgraphia means addressing both the motor and the emotional side of writing, building skills, boosting confidence, and giving them tools so they can express their knowledge. Motor dysgraphia is just one type of dysgraphia. Leave a comment on what else you want to know.